Hello and welcome to the latest episode in Seconds Count, the podcast of the Northern Ireland Ambulance Service, which brings you behind the scenes of how we deliver our service to you. Over the past number of years, the Ambulance Service in Northern Ireland has developed a number of specialty teams. And one of those teams we talked about 2 weeks ago was our HEMS team, the Helicopter Emergency Medical Service, which is basically known as the Air Ambulance. But another team that's very specialised is our HART team. That is our Hazardous Area Response Team. And today we're going to talk with Sam McGowan, who's the HART team leader, and we're going to talk about how the HART team is developed and what its role is within the service over and above what our normal crews deliver. Sam, you're very welcome to talk to us today.
Hello, John. Thank you very much. Thanks for having me.
It's good to have you. And just like everybody else, I think that if you have watched any of these, my first question is, how did you come to be involved in the ambulance service?
So I joined the ambulance service at the age of 21. Over in England, lived down in Guildford at the time, South East Coast Ambulance Service, CCAM, put out a recruitment for emergency care support workers, which was a Band 3 role on a frontline ambulance. Joined that, and through the in-service programme was very lucky to quite quickly get on to an internal paramedic degree and completed that in St George's University.
So did you go from ECA the paramedic degree?
Yeah. So
you didn't do EMT or?
So there was So it was about a 3 to 4 year process all in all, and they put you through an associate ambulance practitioner program as part of that. So you became. I became an associate ambulance practitioner and worked as that full time on the road for about 2 years whilst I was doing the paramedic degree. So we worked full time, 1 day a week in university. And then at the end of that, qualified as a paramedic.
And then you qualified as a paramedic, and you were working as a paramedic in CCAM, were you?
Yeah. So I worked as a paramedic.
Many years there?
So worked as a paramedic in CCAM. Total in CCAM was from 2013 to 2019. So 6 years in total. But 2 years, the final 2 years of those was as a paramedic.
And in 2019, what happened?
2019, met my beautiful wife, and we've moved back over here. She's from Antrim, grew up in Antrim. So now we live just outside Ballymena. So I joined NIAS as a frontline paramedic, worked in Ballymena for just shy of 4 years, and then applied for the job as a HART paramedic, Hazardous Area Response Team paramedic, and I've been there now for 4.5 years.
Okay, so you've mentioned HART straight away.
Yep.
Right in there.
Yeah.
Okay, so what is HART? You explain to me in layman's terms, what is HART?
Yeah, so HART has come about over the last couple of decades, really. Primarily it was orchestrated over in England, and it came about because as an ambulance service, there was many incidents, large-scale incidents over the years. The 7/7 bombings were probably one of the highest profile, where on the back of that, learning came, where actually, whilst there was a lot of frontline responders that entered the tunnels in London to go and assist honourably and bravely with these casualties, there wasn't necessarily the right governance and training provided to the ambulance responders.
So ambulance crews went in with the fire service and other rescuers.
Yeah, absolutely. So that robust governance process where paramedics are trained appropriately, they have the appropriate training, the appropriate supervision, and then the appropriate PPE and equipment to do so. And then whenever we deal with these major incidents, it's about having regularly exercised the triage processes that are involved in those hazardous areas to try and optimize the amount of lives that can be saved.
So prior to 7/7, what was the process then?
So processes prior to that, it had been talked about that frontline ambulance responders maybe needed more training and that support, but it just hadn't come to fruition yet.
Yeah, but if you take a major incident, for example, where there's response from the ambulance service, the fire and rescue service, the police, what were the rules prior to 7/7? Did the ambulance service just hang back?
Not necessarily. I mean, there was no safe systems of work for clinicians to safely access patients in these hazardous area. It didn't mean that they didn't do so. Sometimes at undue risk.
Yes.
Sometimes with control measures put in place by other services. But now we have the ability to, as clinicians, to safely integrate into those safe systems of work, facilitate those safe systems of work on occasion, and then access these patients and treat these patients.
So that's really bringing the care to the patient where they are lying injured.
Absolutely, yeah.
Previously, on many occasions, I know you're saying that sometimes the ambulance crews would have went in, having carried out what they consider to be an appropriate risk assessment and went in to deliver that care. But on many, many occasions, it would have been a case of the patient being brought out to the ambulance service.
Very much so, yeah. So historically, that was the safest way for these patients to get treated. It was for ambulance crews to wait for the patient to be brought to them. And what HART now offers the patient is the ability to be treated in that hazardous environment, and for that appropriate treatment to then be continued by frontline ambulance crews once we're able to facilitate extrication. So as HART paramedics, we can manage and guide that extrication with the helps of our partner agencies, maybe the likes of the fire service.
So at the moment, it's still not the case that every paramedic, every double crewed ambulance that arrives at a scene can just go into a hazardous area. We have a specialist team.
Absolutely.
And we alert our teams to that.
Yeah.
What sort of incidents would they be alerted to?
So we have a number of capabilities in HART here. So the primary role of HART initially, when it first came about, was about the urban search and rescue piece. So that would include confined spaces. And a confined space may not just be a really small tight tunnel. Technically a football stadium could be a confined space if certain other factors are included in that. So it's about recognizing and working within confined spaces, working at height. So potentially building sites, bridges. There's lots of natural features around Northern Ireland, cliffs and what have you. So working at height is included in that as well. We then have the ability to access patients remotely. We integrate with maritime rescue services, and we can deliver care in conjunction with them. We integrate with Coast Guard, as I mentioned, the coast, cliffs. Yeah. We would sometimes we have the ability then to safely be winched up to helicopters if needed be with the Coast Guard. Sometimes they ask us to, sometimes they don't. We then also provide safe systems of work around chemical, biological, radiological, and nuclear risks incidents. Yeah, sorry. And so then that also falls into hazmat. Hazmat would be the overarching term for hazardous materials. And so, again, Northern Ireland, a lot of agriculture, farms are incredibly, they can be incredibly dangerous if they're not appropriately managed. And around the likes of slurry gases would be something that we would come into incidents where the gases have played a part in why people may be injured. So we can manage risks, help integrate and manage risks around that, and facilitate a safer ambulance response.
So, we just didn't wake up one day and say, right, we're going to switch this on now. Obviously, there was a lot of training involved. Who facilitated and oversaw that training?
Yeah, so HART in Northern Ireland has been full-time since 2019. And so a robust training package has been kind of put in place from then. The training package for a new HART paramedic is around about 3 months long. And then that training covers all of our capabilities. So when we come back to those urban search and rescue ones, we also have high consequence infectious disease transfers that we can facilitate, and patients along that line that we can manage. We have water operations as well. So if there's people in water, people around water, we can safely manage those incidents. If necessary, we can deploy into...
And who facilitates the training? Who facilitated the training in the early days, first of all?
So it was off the back of the fire service. So the fire service provide a lot of the technical rescue capabilities, the safe systems of work. So earlier training was provided by fire service, and then we have various training providers across the board. Some of the training is carried out internally with appropriately accredited instructors. Some of the training is facilitated by private training providers who are, a lot of them are also members of partner agencies that we work with regularly anyway. And then other training is provided by partner agencies themselves. So the likes of the fire service would be probably the most common one, although we do work alongside very closely with the police, and they would some of the police teams would also facilitate some training for us.
So the public can be very confident that when our HART team is called, it's a potentially a very serious incident, and they can also be very confident that you guys are highly trained and highly skilled, and your main aim is to deliver the best care possible for the patient in collaboration with our road crews, our HAMS crews if they're at the scene, but also with other partner agencies who may be at the scene. How does that partnership feel? You know, because ambulance service was always a very standalone type thing. We went out and we did our bit and then we were away. But in these instances, and if you do take the likes of 7-7, if you do take the likes of the Manchester Arena, you know, there needs to be a huge degree of coordination and collaboration. How do we find that work?
Yeah, so you're right, John. So primarily, we would work under the JESIP principles, which are a set of principles applied across all emergency services, with aspects of the military included as well. Using those principles, that allows us to facilitate and maintain relationships with these partner agencies, to use the primary principles of shared situational awareness and of that joint understanding of risk to safely manage incidents. So when we turn up at an incident in Northern Ireland, we're very, very fortunate in that we have one ambulance service, one police service, and one fire service, and that's quite unique within the United Kingdom. And what that enables us to do is, we as a team, no matter where we turn up in Northern Ireland, we will have, from a HART perspective and from the specialist rescue side of things, the specialist rescue team that's provided by the Northern Ireland Fire and Rescue Service will always be the same. So that familiar face, it enables us to formulate a flash team very quickly with people that we're familiar with, and that team works really well. In terms of those JESIP principles, that's applied across all frontline responders, all emergency services. And then within that, it allows us to turn up at incidents and to have a system that we can work to jointly work. We have, the police will be able to manage and maintain the legal side of things, and have that sort of level of input. The fire service would primarily be involved around those safe systems of work, the risk, recognizing the risk, managing the risk, and then, as you said, the ambulance service are there for the clinical piece, to be able to just start that journey of care for those patients.
And for that to work properly, there must be a huge degree of trust across the services and each other. Okay, you said 2019 we've been HART full time. I'm just wondering, with the fire service maybe having been primarily responsible for this sort of work previously, there must have been sometimes thinking, we'll keep an eye on this just to make sure these guys are doing it right. But we're well embedded now, and I would say there's a huge degree of trust from the fire service and the PSNI in what our guys do at the front line.
100%. Every single ambulance crew, I'm very lucky now that, part of every frontline responders training in the ambulance service includes training around these principles of interoperability. And as such, with other frontline responders, like I said, police and fire service, every frontline responder is trained in these principles and is able to apply them. And as you said, that strengthens those relationships. It optimizes the response. The response that the patient gets, so the people affected get, and the relatives, but it also optimizes the safety of all responders, and it allows everybody to focus on their individual jobs at the same time, coming together with the safe knowledge that these other things are covered on scene.
Yeah, and we've mentioned 7-7, we've mentioned Manchester Arena. Those are the things that spring to mind immediately, UK-wide. But we did become involved in a very serious incident a number of years ago at Creeslough. You remember that? How did we perform at that, in your view?
Yeah, so Creeslough Creeslough was declared a major incident by the National Ambulance Service.
The National Ambulance Service is the ambulance service of the Republic of Ireland.
Yes, sorry,
which means that our HART team would have had to cross the border. And for those who aren't familiar with it, it was an explosion at a petrol station, isn't that right?
Yes, that's right. Yeah. So it was an explosion, as you said, at a petrol station. There was flats above the shop, so there was a shop at the bottom, and there were some flats above that, and then there was an explosion. and unfortunately, a lot of people lost their lives. So that once this major incident was declared by the National Ambulance Service, they requested mutual aid from the Northern Ireland Ambulance Service. So the first responders from NIAS were frontline crews, PCS crews. There were some officers to assist with scene management that were nearby. This incident was in Donegal, so these resources were all from the west, from around Derry, Londonderry. HART at the moment, we are based in Lisburn, just the Moira side of Lisburn, and so we responded from there. So HART is very much a support asset. It's not necessarily a primary response all the time, but it is always there to support and to complement the work that frontline crews do, and to be able to facilitate, as we've already touched on, the safe treatment of patients, and to be able to start that patient's journey of care as soon as is possible, even if they are in an environment where frontline ambulance crews can't access because it's not safe for them to do so.
And so coming back in to Northern Ireland, has HART been deployed for any other major incidents?
Yes, so a couple of years ago, we had a double-decker bus full of school children that came off the road down in Carrador. Fortunately, the majority were very minor injuries, but what we had there was a very large number of children that had a mechanism of injury that could have led to multiple very serious injuries. And so as HART, again, frontline ambulance were crews there, frontline officers were there with some putting in a really good system of scene management, and HART came and we complemented that response. There was a couple of patients that needed help being accessed inside the bus, and with working very closely with our HEMS team that day, that safe system of work was able to be put in, the risks were able to be managed, and we were able to access as the patient along with HEMS inside the bus to be able to treat a couple of patients. But as I said, it's really about that scene management piece, familiarity with having exercised these is something that we're very privileged to have in HART compared to frontline ambulance crews. Obviously the ambulance service spends a lot of time under extreme pressure, and frontline crews don't necessarily get the training time that they would like to be afforded. We in HART, our training is mandated. It is a legal requirement. We have to be on the top of our game. We have to be fully compliant with every single one of our competencies that allows us to operate in these environments.
Yeah, and I just want to go back to Carrador because although thankfully there was nobody seriously injured, right? But it did show that the system in relation to the activation of HART, of HEMS and of our crews, that actually works. It does work. And in terms of when you reviewed it, did you have this feeling of, thankfully nobody was injured, but we're ready. We know we're ready.
100%. Yeah, absolutely.
And in terms of a normal day for a HART paramedic, run us through that.
Yeah, so we work 12-hour shifts. We work rotas, just the way that the majority of ambulance stations would. And we're very lucky that at all times we're available to respond to calls, but we also have time set aside for specific activities. So part of the role as a HART paramedic includes being physically fit. We have what we call physical competency assessments every 6 months that we have to be fit for. So, we have time to train for that. We have time set aside to train for that during the day. We have a lot of theoretical and practical training to undertake. Every week we would undergo what's known as directed learning, where there is theoretical training that we'll take part in, and every single week it will rotate through a cycle of different capabilities, and it's just about that knowledge refreshment. We are trained in for these environments that they don't come up every day. These incidents, we don't attend these incidents every day, but we are trained that whenever these do come up, they're safely dealt with, safely managed, and that patients have the best possible care that NIAS can offer them. And so we must keep that knowledge fresh as possible in our minds. And so that's the purpose of the theoretical trainer. We then have practical elements as well. So we have on station, we'll be setting up scenarios, different sort of scenarios using different pieces of equipment that we have. And that training will be facilitated during that shift as well. And so obviously whilst all these things are going on, that's because we are very, very privileged that we do have that little bit more downtime than frontline ambulance crews. And that's why we get this opportunity to undertake this training. It is mandatory. It is a legal requirement, and off the back of inquiries from various major incidents in the past, as we've already touched on, this is something that comes up again and again. Is that training has to be at all times. We have to be up to date with this training, and so that's what we use our time to do. There's also a lot of specialist equipment that needs managed, and that changes from day to day around how we look after that, because we have to keep that serviceable, and then also we'll be touching base with management. We have a HART advisor in NIAS, and we'll be touching base with them just to make sure that if there's anything going on. So that would be our day to day whilst we're not responding to incidents.
Yeah, and there's not a major incident every day.
Absolutely. Yep.
Right. But you do respond to calls, and I've noticed recently from the work that we do in the office, you're starting to attend a lot of RTCs.
Yeah. So as you've mentioned, major incidents fortunately don't happen every day, but we do have skills that can complement the NIAS response every day. Around that risk management, we're very fortunate to have really good technical rescue PPE, and so RTCs with an element of complexity would be something that we would respond to day to day. So that could be because of the number of patients involved, the types of vehicles involved. It could be because the position of the vehicles or the patients, the occupants of those vehicles, the patients within those vehicles. It could potentially be ditches, maybe they've come off the road, ended up in fields. They could be trapped as well. So, when you think of your common hazards, that ambulance crews, have to respond to on a day-to-day basis, twisted metal and glass with lots of cutting equipment provided by the fire service. It's a hazardous environment. And so when we're able to, we go and we do our best to complement that frontline response, and to facilitate safety on frontline cruise parts as much as possible.
Yeah, so you have a key role in enabling the frontline crews to utilize their skill set.
Absolutely. Yeah.
That's very key, because RTCs, if they're nice and clinical, just a wee bump, but if they're on a country road where somebody is down a ditch, the fire service, I've watched them in previous times, they spend a lot of time stabilizing that vehicle, because nobody can go near it, because you don't want to make another casualty by doing something before you're ready to do it, and you play an important role in that. How do you interact with the crews? I asked this of the HEMS team, because when you do have specialist teams, I'm always interested to find out how you interact with the crews and how welcoming is it?
Yeah, so listen, the first people we will always try and speak to is the ambulance crews on scene. We are that support asset. More often than not, there will be an ambulance crew or an RRV, an ambulance clinician of one shape or other that is on scene first, and they must be the first person that we link in with. And then we can reassure them. They can brief us on exactly what the incident is. We can reassure them on what we can bring to this incident. And then, as I said, coming back to those JESIP principles, we're very lucky, I suppose, that we exercise these principles regularly. And so then we have that bit of familiarity with the fire services systems of work, because we are exposed to them more often. And so then in conjunction with the fire service, that safe system of work around that vehicle can be put in place, and then we can access the patient, treat the patient, and then in conjunction with frontline crews, then we'll be continuing that journey of care into the back of the ambulance and handing that over to the crews for them to continue that on to definitive care.
So when you do have this interaction with our frontline crews, do any of them ever come to you in the aftermath and say to yourself, how do I join your team?
Absolutely. Yeah, quite often. Firstly, crews will try and reach out to us to try and for a debrief. They'll be asking for a little bit of an informal debrief, seeing what went well, what didn't go well, and we'll be asking them as well. Because this is a two-way conversation. Yeah. How did we do? How do you think our interaction was with yourselves?
Do you ever get a negative response? Maybe not negative, but something.
Yeah, there's always opportunities for improvement, John. Absolutely. Yeah. There's always opportunities for improvement. Every system that we have in HART, every instance that we attend in HART, it will always be reviewed. We're always looking for those opportunities for improvement. That's how HART has come about. It's by identifying those lessons that have been learned, and learning from them, and implementing systems to try and prevent mistakes from happening twice.
Yeah.
So yes, absolutely, we do integrate with those crews, and we do get people asking, how do I join? When is recruitment? And
how do they join? Because obviously not every member of frontline staff will come across HART at a scene
yeah,
and had the opportunity to ask that. But there are people coming into the organisation now and who have been in the organisation for a while, and they would like to enhance their skill set.
yeah.
They maybe think they've more to offer. They've done their time out on the road, and they'll be looking at the likes of Pam and the like of HART. So how do they become?
So recruitment drives go out from time to time. HART NI is a service that's growing. Again, these review processes that are put in place. Obviously, we're limited, as every public service, by money. But we're always looking for reasons to expand, for opportunities to expand, and so obviously keeping an eye out for these recruitment drives is number one. The type of people that we're looking for, to join HART, you have to be an experienced paramedic. We need experienced paramedics that can use that experience to the advantage of
Is there
patients.
a number of years put on that when you say experience?
Yeah, so we're really looking for historically, it's always been 2 years of Band 6 paramedic experience. That has been mandated by the recruitment. So in addition to that, we're looking for people that will be calm under pressure. We're looking for people with good leadership skills, good time management skills. I go back to we have the privilege of more downtime than frontline crews, but that downtime needs to be managed very well. There is a lot of training and equipment that needs to be updated and maintained. We're also looking for those lateral thinkers. We work off standard operating procedures, or SOPs, in HART for every one of our capabilities, but that doesn't necessarily mean that every incident fits into one of these. So it's about having that lateral ability to say, okay, well, I can pluck this certain guidance from this SOP, certain guidance from this SOP, put that together to make this safe system of work.
When was your last recruitment process?
So the last recruitment process was in 2024. There were a number of people that were put on a waiting list, and then they've been pulled from that waiting list, completed their training, and they joined us 2 months ago. So they've been on the road for the last 2 months.
And how many was that?
So there were seven new guys that joined us, and that brought our team strength to 15. So we're at the moment we're a team of 15.
Yeah. And in this day of equality, are there any female HART paramedics?
Yeah, absolutely. Yeah, we do. We have 3 female HART paramedics at the moment. We get a lot of men and women applying for this job, and of course we're looking for there's many strengths that everybody can bring to this team. So
how then, Sam, would you sell HART to a paramedic within the Northern Ireland Ambulance Service or beyond?
Yeah, so I suppose HART paramedics, we get the opportunity to enhance our skill set. We have the core clinical skills as a paramedic. We are the same paramedic, every other paramedic in the ambulance service. But then we have the opportunity to expand that into a more technical side. So what that allows us to do is it opens doors into partner agencies. We get some quite unique insights into various different spurs of the ambulance service. We work a lot of our workload crosses over with the likes of the HEM service. We would see different teams from the police, working in deployments with them. The fire service as well, we're regularly in touch. Every single incident we go to, has a different element of different emergency services in. So it's more variety. I think it's the best job in the ambulance service. I find it really interesting. I really enjoy exercising that skill set to be able to enhance the patient's journey. That's what we're here for. We're here to give every patient that requires the ambulance service's help the best possible care, and we can do that no matter the environment. We have great people in HART, and we can access these patients, we can treat these patients, and then we can hand over to our frontline crews.
It's interesting, Sam, because you use the line there, and people talk about the ambulance service, and people say it's the best job in the world. And you've gone further and you've said that HART is the best job in the ambulance service, which is the best job in the world. And that's just, that's just a real validation of what you do. So all that remains for me to do now, Sam, is to thank you for coming in. I hope people got a great insight into how the ambulance service is striving to continually improve and to bring the best possible care to patients, and that the HART team is bought into that, heavily bought into that. The reason you become HART paramedics is to bring enhanced skills to improve the life of patients, the care of patients. So on behalf of the public, thank you very much, and thanks very much for coming in.
Thank you very much, John. And listen, thanks again for this opportunity. And if there is any ambulance crews out there, paramedics, we like to think we're really approachable. Please contact us if you're interested in what HART do. I would implore you just to you can send an email to heart.teamleaders@NIAS, and we can try and facilitate show and tells, or get some guys around and show and explain what we do. If you're attending incidents as well where you think our input may be necessary, speak with us. We have a duty phone on us all the time, and then in conjunction with the duty crew and the HART advisor, we can give you guidance, we can give you advice, we can come and support you, and that's what we want to do. We want to enhance everybody's safety, and we want to enhance that patient's journey of care. So thank you very much, John. Thank you.
So there you have it. That's the end of this episode. The Hazardous Area Response Team, an integral part of the Northern Ireland Ambulance Service. If you work in the service and you feel that it's for you, keep an eye out for those job circulars coming out, and they will be very welcoming to you, and they will train you to the standards required. So that's the end of this episode. Thank you very much for joining us again this week, and until next time, take care.